Dear students, I am Dr. M. Suganya, Assistant Professor, Department of Sociology and Social Work, Fatima College, Madurai. Here I am going to present a video on culture and health. So I hope this video would help you to understand how culture influences the health of an individual. Culture is a term that refers to a large and diverse set of mostly intangible aspects of social life. According to sociologists, culture consists of the values, beliefs, systems of language, communication, and practices that people share in common and that can be used to define them as a collective. Culture also includes the material objects that are common to that group or society. Now let's see what and all the cultural factors affects the health of an individual. They are family and community, religion, perspectives on death, gender roles, health beliefs, beliefs about medication, responses to medications. Now let's see how community and family would influence the individual's health. Everyone retains certain beliefs as a result of a family and community influences, especially in other countries. For example, Asian and Pacific Islanders rely heavily on their extended family. Oftentimes, the honor and interest of the family are more important than the interest of the individual. Understanding situations like this when administering healthcare can be very careful and helpful in providing proper treatment. That will be useful in recovering the individuals on time. Religion is not just a hobby or an institution, it's a way of life, and that can add barriers to typical treatments. For example, Jews who abstain from certain foods because of their religion, and therefore there will be dietary preferences to consider when outlining any sort of nutritional plan. Others may believe that their illness is an act of God, and therefore they'll refuse the treatment. Next is death. Death is a natural phenomenon that occurs everywhere. That's universal also. But this is not a question about the life after death or funeral rituals. But if doctors truly want to connect with and help patients, they will benefit from knowing the patients and families' perspectives on dying. They will need to know the proper ways to handle end of the life and then make the transition as comfortable as possible. Perspectives on death will be differ from person to person. Sometimes perspectives or the idea or the notion that we have on death that also can influence the health of the individuals. Now we'll see how gender contributes on the concept of health. Gender roles especially. See, different genders will often have different beliefs regarding medical treatment. For example, women may request less invasive treatments to make them more comfortable. Likewise, gender roles within relationships can often play a role in hindering treatment. One partner in the relationship may be dominant and believe it's his or her job to make all of the decisions. So, decision making can be influenced due to the gender. So, this kind of influences of gender can influence the health of the individuals. Next thing is beliefs. Culture often have different beliefs regarding healthcare in general. For example, certain community people have a low pain tolerance compared to other ethnicities and tends to have higher expectations regarding their physical recovery and expectations of receiving a prescription. On the other hand, those who coming from a Hispanic background desire quick relief but are often less willing to trust American remedies. So this kind of health beliefs can also influence the health of the individuals. Maybe certain behavior related to any particular sickness would be differ from culture to culture and people to people. So these kind of beliefs can affect the health of the individuals. Beliefs about medication. As mentioned in the previous slides, Caucasians have a lot of faith in prescription medications and modern treatments. Therefore, they are much more likely to take their medications as prescribed by the physician. Others cultural groups such as African American and Native Americans may doubt the need for such medication and stop taking it permanently. So taking medications also differ from culture to culture, so depends upon the social structure, depends upon the education system, the beliefs, the knowledge of the people can influence the behavior of taking the medicines. So this also would affect the health of the individuals. One of the most important cultural influences has to do with the way a patient responds physically to medication. Some people from backgrounds other than Caucasians may not metabolize the medications correctly, causing serious complications in treatment. So, for example, Caucasian patients generally tend to handle a wider variety of medications than those of the other cultures do. So responses in taking medications also will be differ from cultural group to cultural group. So this can influence the health. I hope you could have understand how cultural factors would influence the health of the individuals at all level, primary, secondary, and tertiary.